Here we have AP view of the pelvis in 80-year-old with history of ongoing right hip pain. He had right hip hemi replacement a while ago. So what we see on this radiograph is right hip hemi replacement, and there is extensive heterotopic new bone formation or heterotopic ossification superior to the greater trochanter, which is extending beyond the acetabulum. So this is heterotopic ossification or heterotopic new bone formation. So now talking about this heterotopic bone ossification, this is quite common in post-THR or post-hemi replacements. Most of them are asymptomatic. Nearly 50 to 70% of the people with heterotopic ossification are asymptomatic. Heterotopic ossification is graded. The grading is called Bruker grading, grade 1, 2, 3, and 4. There is no need to remember the Bruker grading. You can Google them and find it. It can also be graded as mild, moderate, severe, and ankylosis. Mild is a very few areas of heterotopic bone formation. Grade 2 is a few or multiple heterotopic bone formation with gap of at least more than 1 centimeter between the greater trochanter, heterotopic ossification at the acetabulum, and grade 3 is less than 1 centimeter gap between the acetabulum and heterotopic bone formation, and grade 4 or ankylosis is where the heterotopic ossification is fused with the acetabulum. So in summary, here I wanted to show a case of grade 3 Bruker heterotopic ossification or severe heterotopic ossification in right hemi replacement. Given the clinical symptoms, it can correlate very well with the degree of heterotopic ossification. And I also note in the report that there are no other complications associated with it. The treatment of this heterotopic bone formation is usually conservative, that treated with anti-inflammatories or painkillers and reassure the patient that there is nothing major going on at the site of the hip replacement apart from this new bone formation around where the surgery was done, which is quite common in people with THR, and this is not uncommon or rare, and this is not considered as a complication of a THR or hemi replacement.